And family. My name is Jordan Haynes, and I am here to share with you a health promotion video that I have created on PTSD. I have created this video in response to the pedigree I generated for you, Peggy, in which I noticed that PTSD and its potential associated symptoms of depression and dementia seem to run in the maternal side of your family. First off, I'd like to start with what is PTSD and how does it affect people. Well, according to the U.S. Department of Veteran Affairs, PTSD is defined as a mental health condition whose onset occurs following either experiencing or witnessing a traumatic event. PTSD patients commonly experience varying levels of stress reactions after this event that ensue following certain triggers. These triggers may these symptoms that may happen include flashbacks, nightmares, severe anxiety within certain situations, trouble sleeping or concentrating, and uncontrollable thoughts about that specific traumatic event. There are certain genetic and environmental components that also contribute to the development of PTSD. While PTSD can be developed at nearly any age, there are certain factors that put more people at risk than others. These include long-lasting trauma, childhood abuse or neglect, careers in the field of either a military or EMT, or places where common exposure to traumatic events often happens, mental health conditions like anxiety, dementia, depression, lack of a support system, and those with a biological or blood relatives with history of mental disorders like PTSD or depression. Now you're probably wondering, why does this matter for me and my family? Well, the specific risk factor that I noted about family history and their mental health disorders is definitely prevalent for your family along your maternal side, with your grandmother having depression and dementia and your mother having PTSD from the ages of 25 to 28. Now, according to Skelton and colleagues, who did a study in 2012, about 30% of PTSD cases have a hereditable component. With that being said, it is important for you and your family to understand PTSD, how it's treated, and the potential prevention for the future generations of your family. The main treatments of PTSD include psychotherapy or talk therapy, which includes developing a plan with a certified psychologist and adhering to that plan to help get yourself back to where you want to be. Other avenues of treatment include medications such as antidepressants and anti-anxieties. Often these two forms of treatment are combined to generate a treatment plan that is best for the individual. Another big part of recovery is coping and support. As the individual affected with PTSD, it is important to follow your treatment plan, as most people do recover with therapy and medication combinations. Also, take care of yourself. Eat healthy, exercise on a regular basis, and doing so can reduce anxiety and stress. Be aware to not self-medicate with any alcohol or drugs, and use your loved ones as a support system. They are there to help you, alert them of your condition, and lean on them during tough times. Overall, prevention is difficult with PTSD, but it can be attained. After a traumatic event, many people express PTSD-like symptoms such as anxiety, anger, or guilt, all of which are common reactions immediately after a trauma. The main goal following these events is to prevent this trauma from becoming long-term PTSD that constantly affects this individual. To do so, get support immediately to help recover after these traumatic events. Use your family, friends, and maybe a brief mental health therapy with a counselor, or even turn to your faith. Timely help and support is the main avenue to preventing normal stress reactions from getting worse and developing into PTSD. I hope you learned a little bit about PTSD and can use this in your future affairs. Thank you very much.